So, you know how we're always talking about the future of healthcare? Well, you sent over this TechTalk Nexus episode, and man, it's really got me thinking about how much smart devices are changing things.
It really is remarkable how accessible all this is becoming. I mean, we're way past the days when, only hospitals had access to this kind of technology. It's becoming a part of everyday life.
Right. Like, I'm wearing a smartwatch right now that tracks my steps, my sleep, even reminds me to breathe sometimes. It's crazy to think that just a few years ago, this thing seemed like something out of Star Trek.
I know, right? And it's not just about the devices themselves, but it's really about the data they collect and what we can do with it.
Yeah, that's what this TechTalk Nexus episode really drove home for me. It's like having a constant stream of information about your health, right there on your wrist or in your pocket.
It's like having a 24/7 health checkup without the actual checkup part.
Exactly. Although speaking of checkups, they were talking about these continuous glucose monitors and how they're changing the game for people with diabetes.
Oh, absolutely. CGMs are incredible. They offer such granular insight into blood sugar levels throughout the day.
It seems like that would be so helpful for managing the condition, but I've always wondered, like, how do those things even work? How do they know your blood sugar without actually, taking blood?
It is pretty amazing. So basically, most CGMs use a tiny sensor that's inserted just under the skin. This sensor constantly measures the glucose in what's called your interstitial fluid.
Interstitial fluid, is that?
Like, it's the fluid that surrounds the cells in your body.
Ah, okay. So it's not actually measuring blood directly.
Exactly. It measures the glucose in this fluid, which actually closely mirrors the glucose levels in your bloodstream.
Yeah.
And what makes it so powerful is that it provides continuous readings instead of just, a single point in time.
So instead of just getting your blood sugar checked at the doctor's office, you have a constant stream of data, like right there on your phone. That's got to be huge for managing diabetes.
It really is. It's like, think about checking your bank balance once a month versus seeing every transaction as it happens.
Oh, that's a good analogy. So with a CGM, you can actually see how your blood sugar is trending throughout the day. That must be so helpful for making decisions about what to eat, when to exercise.
Absolutely. It really puts people in the driver's seat when it comes to managing their health. But what's even more exciting is how this all ties into the bigger picture of big data.
Okay, big data. That's one of those buzzwords you hear everywhere. What does it actually mean, like in the context of these devices in healthcare?
So imagine all the data from your smartwatch, your CGM, potentially even other health apps you use, all of that flowing into this massive interconnected pool of information.
So it's like every heartbeat, every step, every blood sugar reading being added to this huge database.
Exactly. And that's what makes big data so powerful. It allows us to see these large-scale patterns and trends that we could never spot with just, a handful of patients.
So it's like zooming out and seeing the entire healthcare landscape from a completely different perspective.
Precisely. We can start to answer these really big questions, like what are the early warning signs of certain diseases?
Or what lifestyle factors have the biggest impact on, say, heart health or diabetes?
Exactly. And then, armed with that knowledge, we can start developing more effective prevention strategies, personalized treatments, maybe even predict health risks before they even show up.
So we're talking about moving from a reactive approach to healthcare to a proactive, maybe even a predictive one.
Exactly. Imagine a world where your doctor knows you're at risk for a certain condition based on your data trends, even before you have any symptoms.
That's pretty mind-blowing. But I gotta say, it also makes me think about, like, the ethical side of things. It's a lot of trust we're putting in these algorithms and technology, isn't it?
You're absolutely right. We can't forget that all these devices, all this data, it's just tools. And like any tool, they need to be used responsibly and ethically.
So while we're geeking out about the cool factor, we got to be having some serious conversations about privacy, security, bias, and algorithms.
100%. It's a conversation that needs to happen across all these different areas: medicine, tech, ethics.
Totally. So speaking of the tech side, what are some companies that are doing interesting things in this space? We were talking about Dexcom earlier.
Yeah, they're a great example. They're making some really advanced CGMs, but they're also focused on user experience, making sure it's easy to use and integrates well with your smartphone.
So you can easily share your data with your doctor, right? No more trying to remember what your blood sugar was last week.
Exactly. It's about putting the power of information directly in the hands of the patient. And then, of course, you have the big players like Fitbit and Apple who've really made wearable trackers mainstream.
Yeah. Everyone and their grandma seems to have a Fitbit these days.
Mm-hmm.
But they've come a long way from just counting steps, right?
Oh, for sure. The latest generation of fitness trackers. They're packing some serious tech. They can track sleep quality, stress levels, even detect things like atrial fibrillation.
It's kind of wild when you think about it, going from, okay, how many steps did I take today to, oh, hey, my watch says I might have a heart condition.
It really speaks to just how fast this field is moving.
Yeah.
Makes you wonder, where do we even go from here? What does the future hold for all this?
Right. What does a data-driven future really look like for healthcare? Are we all going to have our own personal AI doctors by next year or something?
AI doctors, maybe not quite yet, but I do think we're on the edge of some really big changes, Like, imagine if healthcare was less about treating illness and more about just optimizing how healthy.
So instead of putting out fires, it's about preventing them in the first place.
Exactly. A world where your medical care is totally personalized, like tailored to you based on your genes, your lifestyle, even things like where you live and what you're exposed to.
Okay, so less one-size-fits-all medicine and more like healthcare that actually fits you. What would that even look like day to day?
Well, imagine getting diet and exercise recommendations based on your DNA,
Yeah.
Or your doctor being able to adjust your meds in real time.
Yeah.
Based on what your CGM is saying.
Wow. Someone more precise and, I guess, proactive. But we've also got to talk about the bigger picture. We touched on it earlier, but the TechTalk Nexus episode also talked about how this data can be used, to spot trends in entire populations.
Oh, yeah. That's huge. If we could analyze data from, say, millions of people wearing these devices, even anonymously, we could track how diseases are spreading, pinpoint environmental risks, things we'd never even think to look for right now.
It's like having a real-time view of the health of a whole city, or even bigger. Mm-hmm. Kind of incredible, but also kind of makes you think about the whole, big brother aspect, doesn't it?
For sure. We got to make sure all this data is being used ethically and responsibly. That's a big responsibility for tech companies, for doctors.
Right.
For everyone, really.
Absolutely. Seems like we're on the verge of something huge here, but like with any big change, we got to be careful about how we handle it.
Couldn't agree more. It's going to take a lot of careful thought and collaboration to make sure it benefits everyone.
Well, this has been a fascinating deep dive. This Tech Talk Nexus episode really got the gears turning. From AI to personalized medicine, it's clear that tech is shaping the future of healthcare in some really amazing ways. We always say it, but keep asking questions, keep exploring. And join us again next time as we continue to dive deep into the topics that matter.